Hi, I'm Dr. Drhurme from Amityville Wellness, and tonight we're going to learn how to decrease some of that upper back tension that I know everyone is feeling from our virtual world. So, few easy things we can do is first, upper back pain is often not caused by the musculature in your upper back, believe it or not. It might sound crazy, but with everything in front of us all the time, the computer in front of us, everything we do in front of us, a lot of the pain in the upper back comes from the muscles in your upper back being overstretched. They're pulled. They get pulled on, and it's actually caused by the tension in your chest and your anterior, the front of your shoulders. And so what we want to do to help loosen up the upper back is actually open up the chest. So an easy way to do that to start is if we just raise up our shoulders up to our ears and then drop them down, and you could do it with me. Come on up and down. And what we're doing is we're massaging the back of our muscles along our ribs, and we're getting the shoulders going, which is going to help to loosen up the muscles in the in the upper back. Then let's do shoulder rolls backwards. Now we don't need to do shoulder rolls forwards because that's the position we're always in. So we're just going to go nice and slow. Up, back, down, and forward. Up, back, down, and forward. Very good. This feels good. All right, now next what we're going to do is the front of your shoulder, if you're looking at your shoulder, if I have my shoulder like this, you have your armpit right here, right next to it, right along this line here. I want you to press right in here. When you press right in here, you're going to feel a tight band if you go back and forth in front. Right in here, you can wiggle back and forth. You'll feel a band. It'll be tender in there. I want you to press your fingers in there and move your wrist backwards. And when you do this, you're going to feel it's going to feel painful. And relax it down. It's going to open up that shoulder. So we'll do it again. You'll find that tender spot again. Push in. Move your wrist backwards. And it's going to open the shoulder. Very good. And we can do it 3 times. Press in, bring the wrist backwards. Good. Very good. Next, what we're going to do is we're going to go along our chest. So if you put your hand, you could do it on both sides if you'd like. Obviously, you always want to try and do things bilaterally. Do it on both sides. But for tonight's sake, we'll just do it on the one. If you put your hand on your chest, right, on your breastbone right here, you're going to walk those fingers out to the side. Right before you get to that shoulder, that spot that we were just talking about, you're going to feel your pects. Big, tough, mushy muscle right in here. Like your armpit goes like this. Push right in here. We're going to push in here. Hold our arm up like this and bring your elbow backwards. Good. It's good if you could have a 90-degree angle. So I say we start like this. Start with your arm in 90-degree angle. Push into your pecs right here. Pressure towards the shoulder and bring that shoulder back. Oh, that feels good. You can even look in the other direction. Take a deep breath. Blow out. That gets sore, like immediately. Go again. So we're going to hold our arm like this. Push in on your pecs towards your shoulder. Push pretty hard, like maybe a 5 out of 10. Pull that elbow back and look over here. Breathe in. And drop it down. We'll go one more time. Follow your pecs out. Press into the tender spot. Pressure towards the shoulder. Pull your elbow back. Look to the side. And breathe in. Whew, that side is definitely open. Definitely feels different for me. Okay, I'm going to have to do this next one when we finish this. Okay, next technique. We're going to do self-massage. You know when you go up and you grab somebody's shoulders in the back and they're always like, oh, don't stop, keep going. I want you to do that to yourself. Just going to give yourself a big squeeze. You could do it to yourself. You don't have to have somebody else do it to you. So you're grabbing your whole shoulder. This right here, this is your mid-traps, your mid-trapezius muscle. You see it right here? I'm grabbing it. Just grab it, squeeze, and let go. Squeeze, and we're going to work our way down. Now we're back on the shoulder. Your thumb is kind of right in that pec area, right kind of where we started. Squeeze in there. let go, squeeze, let go, and you might as well just work down the arm because it feels good. And we could do it again. So we're gonna start up here high at the high at the trap, high up. You could even have your fingers touching the base, touching your spine if you have that enough range of motion. Reach back and grab right where your spine is. Grab it and relax, grab. Squeezing really hard. This is actually called a quack or a duck technique. I forget, I think it's a duck quack, something like that. Squeeze hard and relax. Squeezing super hard. Relax. And this is going to open up. So this is actually going to relieve your upper back pain. Watch, you'll see. Good. And then what we're going to do, instead of just doing our shoulders, we're going to come all the way up, back, and down. Up, back, and down. Now this is really easy for you to do at your desk. You can do it anywhere. If you come to my office, you'll catch me doing this in the halls before I go in to treat the patients. Because again, all my work is in front of me, even if I'm not on a computer, even if I'm treating a patient, everything's right in front of me. The last thing we're going to do is we're going to strengthen the upper back and stretch the chest. This is one of my absolute faves. You're going to put your hands, you want your elbows to be 90 degrees, like this, come like this, and we're going to try and squeeze the back of our elbows. We want the back of our elbows to touch. Probably never going to happen, but let's try. So you're going to squeeze as hard as you can with your hands at a 90-degree angle. Squeeze, squeeze, squeeze. And what this is doing is we're stretching the chest. And if you just did the one side with me, actually I feel the difference. The right side's super tight and my left side's a lot looser. Squeeze, squeeze, squeeze. Put those arms up. Even try and get the back of the hands to touch each other. Squeeze, squeeze, squeeze. So you're strengthening the rhomboids, which is in the upper back, the traps, and we're stretching the chest. Squeeze those elbows together back. I'm sweating. And drop. Woo! Holy cow. You guys feel that? That's hard. Oh, that feels good. But that stretch and strengthening exercise at the end, that's what you want to do. That's going to lock it in. Because we need to strengthen the upper back. Because remember I said your upper back pain is being caused because you're overstretching it. Because everything's curled up forward. So if we strengthen it, correct the posture, open the chest, then the upper back pain will go away. Okay? So I hope everyone enjoyed that. Make sure you get your other side, because my other side now is super, super tight. But if anybody has any questions, go ahead and comment down below. Like, share, subscribe. Make sure you get outside, get into nature. Live life in balance, and be well. I'll see you next time.